Ke lamogela mo lenaneho le lengwe la Raising Babies 101 Infants Edition. Re bula puo ya rona gompieno ka prevention of mother-to-child transmission of HIV. Mo Big Dilemma re kopana le mme o tshwenyegileng o batla go itse gore a tlhophe tsela e feng ya go pepa, natural or medical birth. Mo Easy Peasy re go fa di-tips tsa dilo tse tshwanetse di pakeng mo bekeng ya gago ha o ya sepetleleng o lo go pepa. Tsotlhe tse le tse dingwe right here mo Raising Babies 101 Infants Edition. Dumelang bomme le bontate le bohle babogedi ba rona ba ko gae. Lebitso la ka ke Carol. South Africa's prevention of mother-to-child transmission of HIV program has achieved a substantial reduction in passing the virus from mother to baby. However, prevention of mother-to-child transmission is currently facing an increasing number of babies who acquire HIV infection during the postnatal period. Rulafatsi, the medical doctor, HIV activist and mother, Dr. Tshepi Vundla. Welcome, Dr. Cindy.
Thank you.
Now, what is the important role of medications for prevention of mother-to-child transmission?
So HIV treatment works by lowering the amount of virus you have in your blood. So we know that if you take your treatment properly and the virus is undetectable, then you can't transmit the virus to baby during pregnancy, during labor, during delivery, or during breastfeeding. So it's very important for every woman that's pregnant to test for HIV. And we find out that you're positive, we start you on treatment on the same day, and we make sure that you stick to your treatment all throughout your pregnancy and then, of course, beyond that.
Why is there a high treatment dropout?
So what happens is that after you've had a baby, many people go and live with their mothers-in-law or with their mothers or relatives. And if you haven't disclosed to anyone in your family, the chances of you taking your medication every day are smaller because no one will know why you're taking medication at the same time every day. So I always encourage the patients that at least tell one person that you can trust and then let them know why you're on this medication, why you have to go to clinic every month or every 2 months and so on. So the disclosure is an issue and the stigma still remains a big problem in our country.
Now we've got medications that can prevent mother-to-child transmission, and a lot of people are still very skeptical, is a very loose word I'm using, about taking the treatment. Please, for our viewers at home, explain to them once again just the importance of taking them and being timely with taking them, so not missing any of their tablets. Yes.
So yeah, I think the problem was, you know, in the past, the HIV treatment we used in the past used to change people's bodies. So some people, you know, get bigger boobs or they get smaller legs, and people still remember that. But the medication we have now is new. It's like the latest medication that everyone around the world is using, and it has very few side effects. So it is important for people to start their treatment, stay on it, and if you notice any changes, tell your doctor or your nurse, because we understand what's going on and we can change to something else if that thing that you're taking isn't working. But it is important to take your medication every day, same time, to make sure that your virus stays undetectable.
Now, what happens when a person has transport issues and is unable to go to get their treatment? What happens there?
Oh, Queen King Carol, I think that's one of the challenges of South Africa, is that there are some people who aren't always able to go to the clinic and get their medication. So what we've started doing now is that if we put a medication yako and your virus is undetectable, we try and give you 3 months supply, but there are some patients who must still go in every month. So that is a challenge for us.
What advice do you have for expectant parents who have not gone for the HIV testing?
You have to test for HIV. And if you're negative, we test you every 3 months throughout your pregnancy and throughout the breastfeeding period, because unfortunately, as you said, postnatally, you could still get infected. So some people do get infected after giving birth, and then they transmit the virus to their babies. So every 3 months, up until you stop breastfeeding, you have to keep testing for HIV if you test negative at the beginning. Obviously, if you test positive, we start you on treatment, we test your partner as well, and then you make sure you stay on medication for the rest of your life.
Now, what are the programs that are available for mother-to-child prevention?
all the government clinics have got antenatal sessions where they counsel the parents and they counsel the moms and they speak to them. And then I know the Department of Health also has Mom Connect, so you can connect to that and get SMSs telling you what to do and so on. And then some people do have small groups that they start, like privately, like moms get together and they're all HIV positive and they can help each other through this journey, because it is a journey, especially if you only find out you're positive when you're pregnant. So there's a lot to deal with. There's a baby that's coming, there's a status, there may be partner issues. So it's important to support each other and just make sure that you have as much knowledge as you can, and then of course reduce the stigma around HIV.
And when can mothers do HIV care? Is it only available in the clinics, or are there other places that people can go?
So in the private sector, we do it as well. So if you go to your gynae has to offer you a test. But remember that in the private sector, we don't just test people, right? In the same way in the government, we don't just test people. So you can't assume that your gynae has tested you if they haven't spoken about it, because you need to be counseled, you need to understand what the test is, and you also need to sign consent. So some parents assume that the test has been done because the gynae took a whole batch of bloods, but it doesn't work like that. And if your gynae does test you without counseling you, that's also not allowed.
Wow. And I guess the one thing, a lot of moms already, you are pregnant, you are anxious. Now having to test on top of that can make a mom super, super anxious. What are the words you have as just that final push, that go and test?
Well, HIV is not a death sentence any longer. I think we all know that. The medication is the latest medication, very few side effects. So please don't be scared. You're doing it for your baby and for yourself, so do go and get tested.
Well, thank you so, so much, Dr. Vundla. We really appreciate it. I think the biggest thing you've given us here is just to make it part of your routine.
Thank you.
So le utlwile ge ko gae babogedi gore tshwentse le tsamaye le lo testa. It's so, so important to know your HIV status as a pregnant mom, and also continue checking your status, as you heard from Dr. Vundla, every 3 months. So coming up after the break, re bua ka medical versus natural birth. Ke efeng e wena o tla itlhophang? We talk about this and more coming up next. Raising Babies 101 Infants Edition. Another choice to make is whether to give birth naturally or medically. Amanda Zwane, an expectant mother. We mile ka ngwana wa gagwe wa pele, mme o ipona a sa tsebe gore a tlhope jwang. Go mo thusa ka sone se, re na le Sister Frida Ngwesane, a midwife. Amanda, how are you?
Good, thank you. And how are you?
Good, thank you. I'm excited about this discussion because for most of us, it's a very, very difficult decision whether to go medically or to go naturally. And I know you are in that situation. Talk me through
since it's my firstborn, so you hear a lot of stories from friends, from family, or with their experiences as to how it went and whatnot. So it gets tough for me to decide which one I want to go through with. Naturally, I know there's pain, though I can't be scared of something that I do not know. I haven't done much research on the medical side as to how it will go. So I'm caught in between. Which one is right?
The one you want to go. Okay, I can understand that. Sister Frida, ke mo wena o kenang mo kgang e yanong? Re bua ka yone taba ya medically or naturally?
Let me first explain what a midwife is. So a midwife is a bridge between the mother and the baby. And being a midwife, it's not only to deliver that baby. It starts when the midwife has to start with the mother, slowly but surely. What is happening prenatally, what will happen during the delivery, and what will happen post-delivery. So she will be a support, always a support to the mother. And another important thing about the midwife doesn't decide for the mother. The midwife just gives advice. What are the benefits of doing a certain procedure, and what are the disadvantages of doing the procedures. So the decision does not lie with the midwife, but the midwife will support you throughout whichever way you want to decide or you have decided on. She will be there on your side.
So I'm assuming, Jorge, Amanda, you're having a smooth, healthy pregnancy with no complications?
None so ever.
Okay, so of course, if you have the complications, your doctor will then say, this is the way we're going because of the complications,
yes,
like in my case. But Amanda has the wonderful choice to make. So let's walk through the natural birth. What are the benefits of doing a natural birth?
You know, with a natural birth, it's the baby who decides, how do I want to come out? Because you as a mother can decide that, oh yes, I want a natural birth. But the baby, because of the complication, as you mentioned, Karen, that sometimes there are complications that will lead to the doctor to decide that, no, you need another way of delivering your baby. Now, the natural birth, the most important is that the passage the child has to went through as the baby is coming out, it has got each and every step advantage, where I'll mention one, which is very important that it has to happen. As the child, the baby come down the tubes, the baby is squeezed through a passage. By squeezing the baby through that passage, the secretions from the lungs, remember the baby is swimming at the moment. As the baby comes through those passages, the baby is squeezed through that opening, and it squeezes all the fluids and out of the baby's body. Then the baby comes out and breathes the air as the baby is born.
What are the benefits then on the other side of it to give birth medically?
For example, the pain will be there. Let's say medically, because like it will depend on your condition as well. Why you decide, you as a person, not the baby now, you are deciding as a person to go for medical delivery. There are many things. Other people, they will say, I don't like a scar of a cesarean section. Others will say, I don't like a pain. Other people will say, I don't want that push. I don't think I'll be able to push that baby out. Remember, if you cannot push the baby out, it means the baby will end up being distressed. And we must remember that the mother is very important as well here, because you cannot force the mother to say, no, go for the natural birth, because now she'll be stressed, she'll be disadvantaged, and at the end of the day, she'll end up not liking this baby who was forced, you were forced to do it. Yeah.
Right. So with birthing in general, it is a painful process.
Yes.
For both Caesar and for natural birth.
Yes.
What options does a mother have on either side? Of course, with the cesarean, I know you will have your epidural, but with the natural, what pain? I know some people will give birth in water, and others, I know there's all sorts of interesting ways.
You know, when you decide, for example, in water, as soon as the mother said, I want to deliver my child in water, already she has got that thing of, I'm going to do it because I'm doing it where I want to do it. Right. Other mother will say, no, I don't want to have my baby in a hospital setting. That's when the midwife comes, and the mother will have the baby in an environment that is homely.
Amanda, is there any question that you want to ask?
When it comes to you as a midwife, and for example, I choose to have a baby in the comfort of my own home, homely and whatnot. If now the baby has complications, how do I get assistance in terms of that?
The midwife doesn't work alone. Always there's a doctor who is on standby, who will immediately when there's a complication, the doctor will be there. So not that the midwife is working on her own, but she's working parallel with the doctor. Yeah. It's just that the midwife gives you that thing of a mother helping me with my delivery.
For a midwife, do I have to get it beginning of my pregnancy or towards the end?
It's the best when you start at the beginning with her. You go through, that's why I said she is a supporter, your supporter. When you are not feeling well, she'll advise you what to do, what next, what to expect. So from the beginning, if you start with the midwife, I'm telling you, we'll love it.
But of course, Amanda, now you're a couple of months into your pregnancy, of course. So can Amanda now decide if she wants to go natural to get a midwife?
Yes, you can do that, yes. She can, because it's a supporter who is there at the beginning, you know, and throughout she will be with you. You know, some mothers, they will start like, I want to start with a midwife, but end up being in a medical setting, not because she didn't like the midwife, but there are circumstances that causes her to end up changing that I need to be in a hospital setting. The most important thing is that you have to be happy and comfortable at that. It's a special time.
All right. Well, Amanda, which way are you going? Has it made it easier for you?
Natural.
Natural. Yes, go Amanda. I wish I could have gone natural, but I had complications. Okay, ladies, thank you so much, Amanda. Thank you, sister. Really appreciate it, Sister Frida. And all the best with your little one on the way,
Thank
Amanda.
you so much.
Okay. So, as you heard Sister Frida saying, it's important for wena o itlhopele gore batlo o gonka tsela e feng. But ra itse gore mo bophelong you can plan and God loves at the end of the day. So you need to just make sure you do enough reading and enough research about both if you are awarded the opportunity to choose which way to go. On today's Decoding A to Z, C is for chronic villus sampling. Chronic villus sampling, CVS, is a prenatal test in which a sample of chronic villi is removed from the placenta for testing. The test can be done as early as 10 weeks of pregnancy. Chronic villus sampling can reveal whether a baby has a chromosomal condition such as Down syndrome, as well as other genetic conditions such as cystic fibrosis. Although chorionic villus sampling can provide valuable information about your baby's health, it's important to understand the risks and be prepared for the results. Ke nako ya ditaba tse monate wena o ka iponela shopping voucher ya 200 Rand at an exclusive baby retailer. Araba fela potso ena for a chance to win. Is an epidural a medication for pain relief? Answer yes or no. Araba potso ena mo Facebook page ya rona. Go tseba mang, you could be a lucky winner. Raising Babies 101. Right now, it's time for Easy Peasy and ke tlo le bontsha gore le paka eng mo bekeng ha ile nako ya go ya ko sepetleleng. So, ha re thome ka mo le ntho tsa ngwana, all right? Make sure o na le di leiri, wipes for the boo-boos, some bum cream, of course. Le surgical spirits, kare o tlo go cleaner the umbilical cord ya ngwana at every nappy change. And then o tlanka le dikobo to keep babies nice and warm, the receiving blankets. Le diaparo tsa ngwana, make sure you have a variety of clothes, especially o shebe gore what time of the year baby is born. If it's cold and winter, make sure o tswere le di jersey, le di kousu, and some nice warm vests. I always put vests on my children. Winter, summer, all year round, my children back into the vest. And then for you, it's important gore o ipakele a separate bag. Na ke rata go paka bag for nna and then bag ya ngwana, just to keep the things separated. Also have bottles for bomme batlo go fa bana formula, and of course if you're breastfeeding, which is the best way to go, you can also express some milk o kenye mo di botlolong as well. And then for yourself, it's important gore o pake some nice comfortable sleepwear like the pajama tsena and wonderful slippers to keep you warm. Also make sure una le di maternity pads o tlo di tlhoka tsone tseo because you're going to need them. O tla bona ko pele why. And then you'll also need the toiletries tsa gago, like your face cloth, your toothbrush. And then also, because o tlonka di nepe le ngwana, take your makeup bag with you. O ikhabise o be montle for your photographs as well. And o ska lebala pene go tlatsa di form ko sepetleleng le di form if sepetlele go fatse di form before o ya o lo belega, make sure you take a pen and those forms with you. And then what's a hospital visit without the snacks? Make sure you bring some snacks and your charger to charge your phone. Easy yang go paka beke ya gago go ya sepetleleng. Just remember to keep yourself entertained. If o rata go bala, take a book. If you like listening to music, nka music ya gago. And most importantly, make sure you read up a lot about what else you personally would like to put in your hospital bag. Who easy peasy. That's why Ribita easy peasy. Yummy Mami wa rona gompieno ke Tshepi Vundla. She is an influencer, a mom, and of course, all-round fabulous. Welcome, Tshepi.
Hi, Carol. How are you?
I'm good, thanks, and you?
I'm good, thank you.
I think the first question, how do you look so fabulous as a mom? They take so much out of you.
Well, it's part of my work. So, like, as exhausting as it is, I need to look the part. So, I have to get up and do eyebrows on fleek, put the wig on. It's a lot of work, but I do enjoy it at the same time. And I know how much my appearance means to my brand, so I have to do it, yes.
Absolutely. I mean, you've got tons and tons of followers on social media, and of course, they follow you for your fantastic fashion, the content that you post, and all of that. Does it take a lot of time preparing what you're going to be sharing with the world?
Yes, it really does. People don't understand how much work goes into creating the content, especially when I have to take content with Siba, and Siba's just not in the mood. And I'm just like, hey guys, content is coming, Siba's just in the mood. Got the years, like, you get what I'm saying? Like, it's a lot of work, and people just think it's glamorous all the time. I'm just like, it's really not, yeah.
We spoke earlier in the show about choosing whether to have a natural birth or a medical birth. Did you choose, in your case, which birth way you were going? And how did it go for you?
With my birth, so I was scared throughout my pregnancy, and my gynae and my partner Jay was saying, you're not going to push, you're going to have a C-section. I'm like, I'm going to show you guys, I'm going to push, I'm going to push. Then the day I was induced, and I got induced like at 4 a.m. And then by like 11 a.m., I was cramping really badly. And I was like, guys, how, like, can we do this now? They're like, Sissy, you're still on 0 centimeters. I'm like, what do you mean? And then I had a panic attack, and the guy was like, Matepang, but I told you you're gonna have a C-section. So I was just like, cut me up, it's fine, let's just get it over and done with. I was happy with my decision. It was like, I was fine with it, yeah.
You were happy with it. That is such a funny story, because a lot of the time, women are either going to go this way or another way. And it's so funny how in the moment, you were like, this is enough. It was just a lot.
Yeah, it was, I was crying so badly. And I think, because I suffer from anxiety, so I was just super anxious throughout my pregnancy. And then when the time came, I was like, I thought I could do this, but I actually can't, and I'm okay with being like going through with the C-section. It's very scary, but I'm happy with my decision and my final decision, yes.
It's such a difficult journey, and every mother has her own way of doing things. What would you say is number one tip ya to a small child?
My number one tip would definitely be patient. And as hard as life is, and you're going through your own problems, and it's easy to take out your stress on umntana, and it's just like, so you have to pull yourself towards yourself and take a few seconds before you take out your stress and like give your child a hiding, and there was literally no need. So I think patience, and also learning when to walk away. Like, even if you lock yourself in the bathroom for 2 minutes, I think that's very important. And I've learned that with my mom. Like, she's like old school. She's not that old, but like how my sister and I raise our kids is very different to my mom. And she's learned with how my sister and I raise our kids. And not to say my mom was abusing us or anything, but she's just saying our generation is so, like, we have so much information now. Like, it's, and we have access to nannies. My mom raised my sister and I. Like, now we have nannies. Now we can go on date night for Jay and I. We can go on holiday, and we can alternate who looks after Siba. So I think time and patience are the most important to raise a civilized little human being.
I love how you put it. Time and patience. Tshepi Vundla, lovely to meet you. You're absolutely gorgeous. Thank you so much for coming to be with us.
Thanks for having me.
All right. Well, it's been another exciting episode of Raising Babies 101. For me, Carol, have a lovely one. Until next time.